Welcome to a new era of news leadership. This is Fox 45 in the morning.
Going to the dentist, it's not always something that's on the top of every child's list of fun things to do, but if your child has cavities, he doesn't have to be scared of the dentist drill anymore, because joining us this morning to discuss a new innovation in dental care is Dr. Bob Anthony. First of all, good morning.
Morning.
Thank you very much for joining us, Doctor. This isn't necessarily new for you. It's a 3-year process, and you're kind of improving it as it goes. Tell us a little bit about it.
Yeah, I got mine about 3 years ago, and like I said, it's a learning process to learn how to use it effectively so that you get the most out of it, not only for the patient, but for us to be able to use it right, too.
Explain what it is.
What it is basically a fiber optic handpiece that brings a laser down a fiber optic thing that when the light hits the micro droplets or water droplets, it kind of like micro explosions, and those micro explosions cause the tooth structure to be blown away. So what you're doing is you're going in there, and instead of using a regular drill like you normally do when you go to the dentist, you just go in there with this handpiece, which looks similar to the regular drill, and you're just taking away tooth structure until you get to enough of it missing that you can go ahead then and go ahead and fill it back up again.
You said one of the better parts of this is the fact you don't actually have to numb them at all.
No, that's the nice thing, not only for me but also for the child or the patient themselves. Where you get in there, you can start working on them basically right away.
Now, is it more effective? I mean, are you finding, obviously you've done it both ways. Do you still do it both ways?
I still do it both ways. It will not take out previous silver fillings.
Okay.
So what I'll do instead is I'll go ahead and numb the tooth up using the laser, and then I can go in back to my conventional way, take out the filling, and then finish up the procedure with the laser.
Obviously, you'll learn more as, I guess, more and more kids come in and more patients come in. But I guess test-wise, long-term, I mean, we know cavities come back in some teeth, things like that. Is this more effective in keeping them away? I mean, what is the
It doesn't necessarily keep them away. What it enables me to do is what we call minimally invasive dentistry. In other words, I do fillings that are, or cavities that are a lot smaller than what they normally are, so I can get to them easier and fill them a lot better and make the fillings smaller.
For the ones that have used them, the kids, I mean, nobody likes the part where you sit in the chair, you got the hook in your mouth, you're draining, you can't breathe, you don't know if you're supposed to swallow or not. Are the kids more receptive to this?
I find kids to be my best patients.
Yeah?
The thing that they like the most is we let the little ones especially put on these special multicolored like sunglasses on, and they get a big kick out of doing that before we start.
How many people, I mean, how many places around the area, maybe even nationwide, are using this method? How did you find out about it?
I found about it when I went to the Chicago Midwinter meeting, went ahead and looked more into it because I was kind of skeptical about how it worked. But when I went ahead and went to the BioLays company itself that I bought the machine from, I got more and more intrigued by it, and I finally said, yes, this is the future of dentistry. I can see most offices having this in maybe 10 or 15 years.
Okay, so most of your colleagues probably like it as well.
I don't know. I've not talked to too many about whether they have them or not. I know that in the area of a small town like I'm from, Sydney, Ohio, that nobody else has it, but I've heard someone in Urbana has one. I know there's some in Dayton that have them too.
The key thing is the kids don't mind, I guess, so it's a little bit, they like it a little bit better.
Space age.
Yeah.
Kind of like space age with them. You know, they kind of like the laser thing. We will bring third graders through our practice during Children's Dental Health Week, and we go ahead and demonstrate the laser to them, how it works, and explain it to them and all that, and tell them that in the future this is what you will probably be having done to you.
All right, well, Dr. Anthony's been using it for close to 3 years now, continuing to perfect it, I guess. We want to thank you very much for coming in and sharing it with us. And
can I say one more thing?
Yeah, sure.
The one thing that I do find extremely exciting about using it is not only can we use it on teeth, but we can use it on the gums and the soft tissues of the mouth.
Okay.
We've taken kids that have had what we call tongue-tied, and we go ahead and take and remove their tongue-tied doing a frenectomy, and then we don't have to put sutures in or anything like that, and they heal up within 3 days. So soft tissue is another benefit to the instrument.
Well, if you want to check this out for more info on BioLays, just head to biolays.com. And of course, Doctor, you're located in Sydney, you said?
Yes, I am.
All right, well, check them out.